Okay, folks, we are recording now. So this is our very last Muscle Lab video, number 8 of 8. I'm just going off of the images I have posted on Canvas mainly because trying to run the USB cam in this room with unstable platforms and everything is just causing nothing but problems this morning. And I've lost about 2 hours dealing with technical glitches that never should be occurring. So, muscles of the lower extremities, part 2 of 2, and this is our last video 8 of 8 in the muscle labs. So lower extremities, we have a medial view here, gastrocnemius and soleus muscle. Well, technically this is the medial head of the gastrocnemius, lateral head's not really visible. If I were to stop share here, we can see the muscles of the triceps surae group, basically the calf muscles of the lower leg. You have a medial head. There we go. Let's get this camera on a better swivel. Medial and lateral head of the gastrocnemius muscle. It's a muscle that has two heads, two origins here, up on the medial and lateral epicondyles of the femur in that area. And it has a single insertion down here on the Achilles tendon or calcaneal tendon. And then deep to these two very prominent, fairly powerful calf muscles, I'm pulling the gastrocnemius group off. And underneath them, we have a rather flat, but no less significant soleus muscle. So this is the soleus muscle, the third and deep member of the triceps group or triceps surae group. So medial and lateral epicondyles of the femur are where the gastrocnemius originates. And the action and of course the insertion is down there on the Achilles tendon or tendocalcaneus or Achilles tendon. Any of those three terms is fine by me on a lab exam or worksheet or quiz. And their function is pretty much plantar flexion of the foot. So you sort of flex your foot downwards. That's what these muscles do. They sort of pull the heel up towards the knee joint. You stand on your tippy toes. You're doing some plantar flexion of your feet there. Okay, so that's it for the two most, or I should say, really it's three, because I know the gastrocnemius is considered one muscle, but functionally two origins, and we could say it's two, hence 1, 2, 3 triceps surae group. Okay, now let's rotate this model around very carefully because this thing weighs an absolute ton, and if it falls on the floor, just put a 25-pound dumbbell there to keep it from falling over. And we can deal with the muscles of the anterior portion of the leg here. Okay, so there we go. Rotate this a little bit more anteriorly here. The camera's a little too close, so I'm not sure how well you can see this. We have the patella of the knee, patellar ligament transmitting the forces of the quads down to the tibial tuberosity. We have the beginnings of our iliotibial tract on the lateral side, actually, yeah, wrapping around to the lateral side of the leg here, the knee joint. And then we have the medial side over here. So, tibia. Follow this tibia down, all the way down to the big toe. So we orient ourselves. That means we're looking laterally. We're looking to the lateral side of the tibia. First muscle we see is called the tibialis anterior muscle. Okay, so this tibialis anterior, it originates up here on the lateral, basically, the lateral epicondyle and proximal shaft of the tibia. Patella's here. So this is all lateral, anterolateral view of the knee joint right here. And it's going to go down and it's going to sort of pass. There we go. I don't know how well you can see this, but again, we trace this muscle downwards. Now we're past the contractile portion or belly or gaster. We have a tendon. We can follow this tendon down. And let's focus that camera because following these tendons is so important for succeeding on these exams in the muscle area. Follow this underneath this, this retinaculum here. We have like a flexor retinaculum here. And keep following it. We notice that this wraps around underneath the foot. So I can drop my camera down and there we go. Better lighting conditions here. Follow this, there we go. Follow this tendon from the tibialis anterior underneath these two retinacula all the way, and it's going to go underneath the big toe. Okay, so where this tibialis anterior muscle inserts is the inferior surface, the plantar surface here of the medial cuneiform bone and metatarsal number 1. So this is going to dorsiflex your foot, lift your foot up like this. It will also invert the foot, rotate it medially. Okay, so that's the tibialis anterior, and the action might be counterintuitive just looking at it. People don't realize how these things go down, around, and underneath. On an exam, you got to follow the tendon where it's practical on an image. Now, let us go share real quick with the stuff I have posted on Canvas. So here we go. This is straight up medial view. Tibia bone right here, gastrocnemius, soleus. This little muscle, which we'll talk about shortly, but right here, tibialis anterior. And again, look at it. Look how it goes underneath and then wraps around to insert on metatarsal number 1 and that medial cuneiform bone underneath here, goes underneath these retinacula. Any other view of the tibialis anterior? Here we go, straight anterior view. And we can follow tibialis anterior down, 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 underneath the retinacula, and then it disappears under digit number 1. Okay, gastrocnemius heads and soleus, I talked about. Calcaneal tendon, we covered that. These other muscles we still have to deal with. Okay, so I'm thinking deal with those muscles we should. Let's go back up here and deal with this one right here. And then another muscle that kind of shows up at the base, barely visible, peeks out from around the corner of this little sliver of muscle here. So this next muscle, lateral to the tibialis anterior. Notice the tibialis anterior doesn't come straight down. It originates up on the lateral side of things up here at the knee joint, and it comes down diagonally across the lower leg and inserts on the medial side of the foot. So it goes down diagonal, not straight. Another tricky three-dimensionality of this whole subject matter. Next up is extensor digitorum longus. Okay, so that also originates up on the lateral epicondyle of the tibia and proximal 3/4 of the shaft of the tibia. So that has a long origin, and it's going to come down, follow the connective tissue here underneath this extensor retinaculum. So this is the extensor retinaculum here. We're following it. Look, it goes underneath here and then it splits out like a palm, like a fan-shaped arrangement of tendons going to all the little toes. Like these tendons go all the way to the tips of toes, 2, 3, 4, and 5, or properly digits, distal phalanges, 2, 3, 4, and 5, as you see me circling with the cursor here. So this is going to extend the toe and dorsiflex the foot. So you curl your foot upwards from the ground. So like you're trying to walk on your heels, you're doing some serious foot dorsiflexion there. Now, we have another muscle here called the extensor hallucis longus. Hallux refers to the big toe, and that involves this tendon right here, which I'm following up, and there's this little sliver underneath this tibialis anterior muscle here. So let me see if this other model shows it. Go back to stop share here. Let's see, rotate this thing around the front. So tibialis anterior, flexor digitorum longus, following that flexor muscle down, and right, well, actually, sort of, yeah, I guess I could say this is good. Right, oh, come on, let's rotate this. There we go. Right here is the tendon of that extensor hallucis longus going to the big toe. Hold on, move my camera there. There we go. Following it down to the big toe here. Okay, I got to watch the screen, not where my hands are, and we get smoother video. So let's see if we can't pull this off and find some muscle underneath there. There we go. That extensor hallucis longus, that's kind of this little muscle underneath, deep to the extensor digitorum longus. So on the outside, extensor digitorum longus, yeah, let's see. You see it just goes right on this model. And then on the inside of that, that little extensor hallucis longus muscle. And you can just follow it right down to that other tendon right here. So you rotate it in the light so you can see the tendon from the flexor, the extensor hallucis longus versus the tendon from the extensor digitorum longus, and put these two together. Okay, so that's those two muscles off to the side, laterally located. So there can be some trickiness there and locating these. If we were meeting in meet space in the classroom pre-lockdown, you'd have these models at your lab station during a lab practical. And when I run my lab practicals, you're free to pick stuff up, handle it, rotate it, move it, take it apart, put it back together, put it back down, within the 90-second time frame, of course. Okay, let's rotate things straight laterally here. So, with video constraints and lighting, I'll just point these two muscles out here, peroneus or fibularis longus and peroneus or fibularis brevis. Whether you call these muscles peroneus longus and brevis or you call them by the fibularis designation, I'm fine either way. Okay, so let's go to the images on canvas. Here we go, beautiful. So fibularis or peroneus longus up here, fibularis or peroneus brevis down here. Gastrocnemius, let's see, this is a little toe here, so digit number 5, lateral head, soleus muscle. And what's this one here? This is the extensor. This is the extensor digitorum longus right here, and the extensor hallucis longus would be kind of underneath this one from this lateral view. Okay, so fibularis or peroneus longus. Where does it originate? Proximal head of the fibula and the lateral side of the fibula up here. Fibularis or peroneus brevis originates on the distal half of the fibula, or distal shaft of the fibula. Peroneus longus, the long muscle, goes down and pretty much inserts on metatarsal. Okay, so you see this, follow these tendons. It goes underneath the foot, goes all the way over here and inserts on metatarsal number 1 on the other side of the foot. So this is really tricky. Goes underneath everything, completely underneath everything, and inserts also on the medial cuneiform. This also plantar flexes and everts the foot, kind of rotates your foot outwards so that your plantar surface is facing to the side instead of inwards, and you're everting the foot. Rotate your foot inward, so like you're walking on the side of your foot, lateral side of your foot or ankles, and you're inverting your foot. So this muscle everts the foot and plantar flexes it. Peroneus or fibularis brevis, this goes to the little toe, and you can totally see it. You can totally follow the tendon from the fibularis brevis underneath this flexor retinaculum here, all the way underneath, and you can see, oh, metatarsal number 5 is where this goes. This tendon goes to distal phalange number 5 from the extensor digitorum longus. So again, when you look at these, you gotta follow the tendons. And this band of connective tissue here, this would be the extensor retinaculum. This one here, I don't have labeled as a flexor retinaculum. But since I didn't label it, don't worry about it. I got to go back and retcon that so it shows up and then drop the new term into the Canvas word list. Not going to happen this time. So you guys get that one. You can escape that. Okay, so that's it for the fibularis or peroneus group, longus and brevis. Now let's go to a posterior view here. With the calf muscles removed. So we got to detach these on this model. And here we go. Okay, there's actually a fair number of muscles back here. So we have a popliteus muscle, which is this one right here. It's going to originate up here on the lateral condyle of the femur, and it's going to wrap around going to the medial side of the proximal tibia. And this is going to unlock your knees by rotating the leg medially at the knee joint so you can properly flex. Ever sit down cross-legged on a chair or a couch or at a table or at a restaurant, and then you have to get up and move? Ever notice how it's like, oh, you can't just jump up and move. You got to unlock stuff to move your legs into position first. Well, trying to jump with your knees locked is very bad, as in your life as you know it will end bad and you'll be gimpy afterwards. So you unlock the knee joint with this muscle, then the powerful muscles of the quads and the hamstrings and the triceps can get to work. Okay, so you notice the fibers go at an angle this way. And again, I'm just going off the images posted on Canvas. On the actual model I have in a room here, everything's visible, but the lighting issues would prevent us from seeing things clearly. Now, next up, flexor digitorum longus. That's this muscle right here. So you can see I'm highlighting it with the cursor. Flexor, what am I saying? Flexor digitorum longus, right here is flexor digitorum longus, over here. This little skinny thing is the flexor digitorum longus, originates on the posterior surface of the tibia, goes to distal phalanges, the tips of the toes, 2, 3, 4, and 5. I really should have brought that little itty bitty tiny foot model that I have in, because it doesn't weigh anything and it's a lot easier to use. But I'm going to try something here. I may regret it. But since I have a chair here to set one side of this on and a dumbbell to hold the other side, I'm going to do it. Okay, thus far, it's looking like our mission is going to be successful. Yay, awesome sauce. I'm going to stop share here. There we go. So this ridiculously heavy life-size leg model, it shows a lot of stuff there. What I just pulled off is a plantaris muscle, which is going to be involved with flexion of the toes and extension of the toes, really. And this tendon right here goes to what's called a flexor hallucis longus. This tendon, along with a bunch of others which aren't really visible here, those will go to that aforementioned flexor digitorum longus. So notice how these tendons travel underneath the foot, all the way to the distal phalanges of each toes. These are those tendons. 2, 3, 4, and 5. They go underneath the foot, and let me re-share the screen here. Kind of around the tarsal bones, and they attach to this muscle. So that's the flexor digitorum longus. Now, the biggest muscle in this entire area outside of the triceps group, and even rivaling the triceps group, all we can see is this little bent triangle-shaped sliver of it with actually, that would be the this would be the tibial artery and tibial nerve. There's also fibular artery, fibular nerve here. So underneath these vessels and that nerve is the tibialis posterior muscle. Like the adductor magnus of the thigh, it's absolutely huge, but it's covered up by everything else, so you don't know it's there. It just looks like this small, insignificant thing on this view. Okay, it originates on the superior portions of the tibia and fibula, or proximal portions of the tibia and fibula, and it's going to go down and insert on tarsals and metatarsal bones 2, 3, and 4. A powerful inverter of the foot, a powerful plantar flexor of the foot, one of those muscles that's really important in walking, jogging, running. Okay, so tibialis posterior, it does much, but it appears to just be this small part here. Now, this big muscle labeled 29 that I've avoided talking about, this is the flexor hallucis longus. When you see the word hallucis in a muscle, you think, oh, big toe. When you see the word pollucis in a muscle, you think, oh, thumb. So extensor hallucis. Hallux is just another term for big toe, toe number 1, and pollux is just another archaic term for thumb. A digit on a hand, number 1. So yeah, we can see it's going to originate up on the middle portion of the shaft of the fibula here. So it has a lateral origin, and then it's going to come wrap around behind the foot, behind the lower leg, deep to the gastrocnemius soleus calcaneal tendon, go around to the medial side underneath the medial malleolus, which is the inside of your ankle. And it's going to circle all the way around to distal phalange number 1, your big toe. It's going to plantar flex the big toe. So if I were to share the screen here, whoops, not share, I'm going to stop share and get another view of this. I hate to say this, but I need a special table for this model to do any video with it. It is just too darn heavy. And it's unstable because all the weight's concentrated on one side. Okay, so I'm just pulling this. I'm going to pull the calf muscles off of this, and we're going to take a look at this flexor hallucis longus muscle. Heck, we might as well take a look at all the others while we're at it. Okay, so let's just elevate the camera platform. I got a whole bunch of models in here taking up tons of space. I got my little dumbbell here. Making a stable platform. Okay, so we lift this up. Tibialis posterior. Can we even see it? Here we go. Tibialis posterior. Popliteus muscle right here. Let's see. Flexor hallucis longus. Let's follow this tendon of the flexor hallucis longus around underneath the medial malleolus, underneath the foot, all the way to a distal phalange number 1. Okay, I'm gonna have to turn around and look back, make sure you guys can even see this. And you can see it. So these muscles of the lower leg that act on the feet, they're kind of like pulleys in a complicated machine. They go around things and they insert on the opposite side of where you might think. That makes this three-dimensionally confusing, kind of like a mechanical engineering problem. Okay, let's just put this thing back, stand it back up, and I am done with that. Let us stop sharing here. Actually, let us resume sharing here. So we're now sharing the screen with the canvas material. So we got through the posterior view of the lower leg muscles, the deep ones. That is it for this material. We are done with muscle lab video 8 of 8. Next up will be either the nervous system or the circulatory system, depending.